Mary Potter means everything to me.
It is an absolutely fascinating story, the Mary Potter story. Where they see a need, they go. If that need changes, they change. Since 1885 to the organisation we are today.
What makes Calvary so special is our connection to our foundation and our heritage and to our values and our mission. That makes us special.
The missions and values that she set up, we're still living those. We're carrying on her legacy.
Calvary values are hospitality, healing, stewardship and respect. It's how we wrap ourselves around our patients, our residents and our clients. We want to be for others.
It's the family and the patient that are paramount, providing a good service and holistic care, the spiritual, the physical and the mental care of them and their families.
Calvary today has grown to be a service that looks after public and private hospitals, residential aged care, community care, 12,000 staff, volunteers. We like to describe it as the Calvary Care System, an integration of services across the hospital, the residential aged care and the community and home environments. Our palliative end-of-life care services, we are leaders in the field. We care for those vulnerable people, the sick and the dying. It is a really important part of who we are, and that's been there since the start.
It's about being authentic. It's connecting to what integrity looks like. We are a Catholic ministry, but we are inclusive and welcome anyone interacting with us.
Digital transformation will be critical to the future of healthcare. We need to understand remote monitoring. The big trend will be healthcare as a platform, allowing people to take the services when and where they need to. One of the really exciting projects was responding to a tender from the South Australian Government, which became My Home Hospital, a joint venture arrangement with Medibank, dealing with acute care in the home and trying to deal with the individual holistically in their normal environment instead of in a hospital environment.
When I get compliments from the patients in regards to our nurses who have been out to see them, it does make me feel really quite warm inside to know that we've provided good quality care and then enabled someone to stay in their own home rather than hospital.
RIDE's been around for a long time. We upgraded the residential aged care, we built new independent living units. We've got the new Bruce Private. Calvary Adelaide, 344-bed, state-of-the-art hospital in the centre of Adelaide. Fantastic building. We're looking at a co-location right next door to Launceston General Hospital. Working closely with the public sector is also part of the future of healthcare. Calvary Bethlehem is one of our shining examples of integrated care. We're redeveloping the entire site. Still looking after people in a hospital environment. We're also building residential aged care and independent living. Aged care is a really fundamental part of our business. The finding of the Royal Commission does really reinforce what we are as Calvary. It is actually saying you need to look after our people as they age. We want to make sure that if they wish to age at home for as long as possible, they can.
People are more informed, more actively involved in their care. How we make sure that we remain connected to our identity is being upfront about who we are. We can wrap our arms around the entire journey that we have in this world, from babies to palliative and end-of-life care and home. Because people may not remember what you say to them, but they'll always remember how you make them feel.